As the nation prepares for Donald Trump's return to the White House, the president-elect is making plans for change across many areas of federal policy, including healthcare. Here to help us unpack what this means for the industry is Nick Hutt, senior editor at the Healthcare Financial Management Association. Welcome, Nick.
Hey, thanks, Erica. I appreciate the invitation.
So coming up next year, we've got a Trump White House, we have a Republican Senate and a Republican House. What do you think we're most likely to see happen in healthcare in this new administration?
Well, I'm going to be looking at the implications of the election results for health insurance coverage, starting with Medicaid and the Affordable Care Act. You know, in Medicaid, we could see that turned into a block grant program. What that means is states would get a sum of money, potentially based on per capita caps, to distribute to their eligible population as they see fit, and based on the coverage criteria of their choosing. And that will have consequences for funding levels and the availability of Medicaid to some of the people who've been able to access it in recent years. And then there's the Affordable Care Act, also known as Obamacare. You know, enrollment in the insurance plans available through the ACA has surged over the last 4 years or so, largely because of enhanced availability of subsidies that you can use to buy these plans. But those subsidies expire at the end of next year, the end of 2025, and Republicans are reluctant at best to renew them.
Earlier this month, Trump announced Robert F. Kennedy Jr. as his pick for U.S. Secretary of Health and Human Services. Just last week, physician and TV host Mehmet Oz was named as Trump's pick to head up the Centers for Medicare and Medicaid Services. Both unconventional picks for these offices, to say the least. What do you make of this news?
Yeah, there are a couple of wild cards, a couple of X factors, whatever term you want to use. With RFK Jr., some people are intrigued because he's expressed a commitment to addressing chronic health conditions, such as diabetes and obesity in the United States. And that could represent an important and really a landmark change for health in this country. But then he has views that could be considered pretty far out there, especially as far as public health. So I think he'll win fans if he focuses on chronic diseases and refrains from stifling the nation's medical innovation apparatus, which has always been one of the strengths of the U.S. healthcare system. And then you have Dr. Oz, nominated to oversee Medicare and Medicaid. I think he'll fit well with RFK Jr. in terms of their shared priorities.
Well, we'll definitely be paying attention to this new administration and bringing you any news of developments. Thanks again, Nick, for joining me today.
Thank you.